Welcome all to our YouTube channel. Today we have a very great personality with us. With over 20 years of experience in this industry, Dr. Hidayat Khan, the chairman and the managing director of Humancare Worldwide, has ensured and has been dedicated in his career to provide top-notch patient services and seamless air medical repatriation. Today, he is here to answer the most frequently asked questions on Google about air ambulance services. With his vast experience and expertise, he will answer and help us to understand the critical aspects of air ambulance services.
Thank you very much, Karina, for a wonderful introduction of Humancare and Dr. Hidayat Khan. Yeah, you may go ahead with your frequently asked questions. I will try my best to answer appropriately for all your questions.
Sure, sir. So the very first question is, what is an air ambulance? Like, how would you explain it in a layman's language?
Okay. See, the air medical evacuation, if there is any patient who is at tier 3 or tier 4 cities and want to go a tertiary care center, which is usually present in metro cities, so we can do the air medical evacuation within 2 hours of the patient, particularly to utilize the golden hour and golden period for getting emergency care at tertiary care hospitals with the top doctors of particularly if there is a cardiac case, if there is a golden hour, we have to do the coronary intervention that called as angiography and angioplasty at the same time. The patient can avail and we can prevent the mortality of the patient. Same thing is about cerebral vascular episode. If someone develops any kind of a paralysis because of the infarct, so air ambulance can transfer the patient immediately to the tertiary care hospital. The important factor is there are lots of road traffic accidents are happening as Mr. Gadkari Saab is making wider road and high speed road in India. So this is going to help to save patients' life whenever they met with an accident. So air medical evacuation, air ambulance is air medical evacuation in emergency transportation of the patient to reduce the time basically. So that is air ambulance.
Okay. My next question would be, what are the types of air ambulance?
Okay. So basically there are different types of aircraft. I will more elaborately will answer your question. There are two ways of air medical evacuation. One is rotary wing. Rotary wing is a helicopter. Helicopter we can use for a smaller distance up to 100 or 200 kilometer where airstrip is not possible. Okay. So then we can evacuate a patient at the same site and then we can take the patient to the tertiary care hospital or whichever hospital is nearby to save the patient's life. The second one is fixed wing. In fixed wing, there are many types of aircraft. In India, the commonly used is turboprop, that is King Air C90 and B200. The next come to low size and mid size jet. The low and mid size jet comes as a business jet. In that, patient will have can travel a longer distance in a shorter time. The speed is same as commercial airline. So, for example, Kolkata to Mumbai or Chennai to Mumbai can cover in 1.5 to 2 hours of time. And King Air B200 turboprop will take for Kolkata Mumbai for almost 4.5 to 5 hours of time. And charter flight, particularly turboprop, can fly up to 2000 kilometer max. King Air C90 can fly up to 1000 kilometer max. If they have to fly to Kolkata, they have to take refueling halt. In a jet, there is no need of refueling halt. So we can do the flight directly without refueling. Okay. So these are the types of air medical evacuation and aircraft, air ambulance available at present in India and in the world.
Very interesting. So my next question would be, how big is an air ambulance?
Okay. See, it starts from chopper, which is very compact, as 1 or 2 pilot. Or in rotary wing, 1 stretcher and 1 medic max in chopper. We can have a bigger chopper also. Military has many choppers. So 10 people also can come there with one patient. But commonly used chopper for hardly 2-3 people max can come with the air crew. Second is again a King Air C90 is a very compact machine. Patient, two relatives, two medical escort. Sometimes we consider one relative only in King Air C90. But B200, there are definitely two relatives, or sometimes we have a three medical escort or two medical escort with three relatives on board. In jet, that all depends on which size of jet are you using. If there is a low size jet, again two relatives. If there is a mid size jet, we can go up to three relatives. If there is a big size jet, we can have four relatives, six relatives. If you are going for business Boeing jet, we can have 20 relatives
Oh my god.
on board. So
Okay.
that we have done for few people. There were almost around 17 relatives were the from patient side. When we have shifted one patient from Mumbai to Chennai for lung transplant, almost around 8-9 years ago, the patient was on ECMO. So almost 17 people were there on board, including medical escort and patients.
Okay.
That we have done on CRJ.
Okay.
Okay, so that is almost around 18 seater. They were having a 18 seat other than stretcher packs to accompany. So in business Boeing jet, we can have three patients or four patients at a time
Oh.
with almost around 30 or 35, 40 relatives on board. So these aircrafts are available in India as well as globally.
Next question is a very critical one.
Okay.
Is air ambulance safe?
Uh, it's really a critical question because see, most of the time air ambulance is safe basically. So particularly in low visibility and bad weather, particularly in raining season,
Okay.
we have to fly with careful. The pilot and the air crew will take a call. If there is a dense cloud and bad weather and poor visibility, we usually avoid flying.
Fine.
And but in such scenario, King Air C90 and B200 we don't advise. In such weather conditions, we advise business jet because business jet has capacity to fly in bad weather as well as in low visibility too. Still, in winter and raining season, we have to be more careful for flying, but we can do that.
Okay. I've heard something called as sea level flights. So could you
Hey, who
just
told you about sea level flight?
so could you explain us what it is exactly?
Okay, see, we come across for almost around 5-6 times about sea level flight.
Okay.
See, the patients who are having neurological trauma, either because of vehicular accident or because of the brain hemorrhage, the patient is status post craniotomy, operation is done. Patient is having VP shunt or drain in the brain. So in such condition, we have to maintain the altitude. So sea level flight is usually the turboprop flies up to around 17,000, 18,000 altitude to 24, 25. The jet flies approximately around 30,000 to 38, 40,000 altitude. In sea level flight, the flight will fly maximum up to 10,000 altitude. You can even see the flight is flying at the sea level only, sometimes below than that. So patients who are not indicated to fly at high altitude, in such condition we have to do sea level flights. So it takes longer time to reach at the destination. So there are many other factors we need to consider for sea level flight. So that is about sea. It's a very vast subject and question. So it's not possible to answer for 20 minutes interview. But we have done one flight of sea level for one European patient as per suggestion of their medics.
Okay. The next question would be, at what altitude does air ambulance fly and what is the cabin pressure?
Oh, Okay, no, good question. I think I have covered it in my previous question, the previous answer, but still I'll tell you. That again depends on the type of aircraft what you are using. If you are using a small machine, particularly the turboprop C90 and B200, so it flies from 18,000, 19,000 to 25,000 altitude.
Okay.
That all depends on the type of machine. The second important is the cabin pressure. I will tell you about cabin pressure of King Air C90 and B200. Maintains around 7 to 8,000 if it is maintained properly. The flight is maintained properly. The second important is jet flight. In jet, we fly approximately around 35 to 40,000 altitude, but the cabin pressure remains around 8 to 10,000 altitude because it's a pressurized cabin. So, in chopper fixed wing, we fly up to 10,000, 12,000 altitude, and the cabin pressure remains around 3 to 6,000 or 4,000 altitude. That is about rotary wing.
So the next question would be, what are the contraindicators of an air ambulance?
See, contraindication, we are usually shifting polytrauma, multi-organ failure, any kind of a patient we can shift. According to me, if there is any kind of air pocket in the body and which is closed, which usually happens in road traffic accident or any kind of a traumatic incident to the brain or to the organ, and there is an air pocket inside the body, so the high altitude flights are contraindicated, and in such condition we should avoid flying unless and until patient evaluated properly, all scans and all is done, and there is no air pocket in the body. In such condition, I feel it's a contraindication for air ambulance.
Okay. What are the charges of air ambulance? It's the most asked questions on Google.
See, let me clarify on this. People feel that the air ambulance is very expensive. Okay. I will tell you when I started my career in 2004, Bombay Delhi was costing around 15 lakhs rupees. There were very few people aware, and very few people were obtaining these services. But now in this time, I should say the air medical evacuation, air ambulance is affordable. Because what is happening nowadays, there are many aircraft has come in India for air ambulance. For example, if I have one patient in Raipur,
Yes.
for shifting Raipur to, for example, Delhi, and my aircraft is based in Mumbai, and then I have to drop that patient from Mumbai to Bilaspur. So Bilaspur to Raipur is hardly 20 minutes. So that way we can reduce the cost for air medical evacuation. The cost, usually the turboprop, it's usually basically per hour cost.
Okay.
Whatever is the flying hours and the ground handling at both the destination, and ground ambulances at both the destination. As you know, we provide bed to bed transfer. It is very important to receive a patient from the treating doctor or the ICU doctor from the departure city. So our team goes at the departure hospital, evaluate the patient, take the over. Even though patient is on ventilator, multiple inotropic support, either on ECMO, whatever condition is there, we are able to do the transfer irrespective of criticality of the patient. So the King Air C90 B200 turboprop cost approximately around 120 to 150,000 INR, and jet cost around 350 to 450,000 INR of low size and low size jet, mid size jet, and it goes to around $25,000 per hour. That all depends. It's a domestic flight or international flight. If there is an international flight, then there is an international handling too. The international handling is little expensive. So that way, the one trip usually costs for Raipur to Mumbai or Kolkata to Mumbai. It depends on the type of aircraft.
Okay.
In jet, it will cost more. In twin engine, turboprop King Air C90 and B200, it will cost less.
Okay.
So hope you got the answer.
Yeah, got some clarity on it. So, what is a commercial air ambulance?
Oh, it's very important people to know what is commercial air medical evacuation. See, commercial air medical evacuation can reduce the cost for almost 60 to 70% of air ambulance.
Quite impressive.
How it works, I'll tell you. In commercial, the facility will be same what we provide in air ambulance.
Okay.
The difference is air ambulance can be activated in 2 hours.
Okay.
But the commercial takes domestic at least 48 hours and internationally at least 72 hours or sometimes more than that. That depends on the which airlines you are using for repatriation. In this, we remove the 9 seats or 6 seats at the type and configuration of the aircraft.
Okay.
And we will make avail oxygen, all medical equipment standby, and there will be Sky ICU facility on board. I will tell you one incident, one transfer which we have recently done. Was a one doctor, he had a hepatocellular carcinoma, was admitted in Houston. They approached us. We have quoted them for air ambulance that was costing more than 2 crore rupees. So they, being a medical person, they came in contact with me through my operation team. I explained them about the commercial transfer and they agreed.
Okay.
So very important index case for us to highlight basically. So when I was talking to them and when I applied for a MEDA clearance in the airlines, the patient was on 4 liter of oxygen.
Okay.
And patient was having ascites, patient was having perianal abscess, and patient was in intense pain. Patient was already on morphine and all. Suddenly, before transfer, almost around 8 days ago, patient shifted in ICU and he was on HFNO. No.
What is HFNO?
Okay. See, this is high flow nasal cannula.
Okay.
In that you can give oxygen up to 80 liter, 90 liter, 100 liter to the patient.
Okay.
So oxygen goes forcefully. So you can even prevent the intubation, the ventilator also. The patient can maintain the oxygen with the high flow nasal cannula.
Okay.
The patient was with on 45 liter of oxygen. So I discussed with the family. I said ki now he is on 45 liter of oxygen and transfer of patient in commercial is not possible. Then I told them ki I would like to see the arterial blood gas analysis of the patient. Fortunately, arterial blood gas analysis was satisfactory.
Okay.
His PO2 level was almost around 190 plus.
Okay.
So that gave me confidence ki before transfer my team can intubate the patient and then we will wait there for 3-4 hours and we do the blood gas. If patient is maintaining PO2 more than 90, we can transfer the patient in commercial. So initially we quoted them for 2 medical escort. After discussion, when patient was shifted, we added 3rd medical escort.
Okay.
In 3rd medical escort, I sent 3 people to US at Houston to bring the patient. Then we did it in one airlines with one halt, technical halt in between of change of aircraft in commercial.
Okay.
So in commercial, what they do, they remove 9 seats. They put a stretcher like a private charter or like an ambulance what we have, that called as aeromedical stretcher. And in aeromedical stretcher, we will have all facility, whatever patient get in the hospital, except dialysis and all other support. But maximum support we can provide the patient in commercial transfer. So we have done that patient successfully and we have landed patient safely with medical escorts. And from here we have done the private charter to Jaipur. And I am very happy to know that sir is CVTS and after shifting here in one hospital in Jaipur, he is doing very well at Jaipur
good
now.
to hear that such a noble cause for
Yes.
society. So my last question to you would be, what is a business class air medical evacuation?
Okay, so I really want to put highlight on this also. There are lots of patients who can comfortably sit.
Okay.
Okay, even though their all extremities are paralyzed, patient is on tracheostomy, but the patient GCS scale is around 10 plus. GCS is Glasgow Coma scale. We measure on the verbal, motor, eye and all. So if the GCS is more than 10 and patient is drowsy but arousable, or answering questions what we are asking to the patient, in this we do bed to bed transfer. Even we can take such patients through medical room directly on the seats through the ambulift and all.
Okay.
Or we can take the patient as a wheelchair as a routine packs to the till the seat.
Okay.
Important is if the patient is on oxygen in business class, we can provide even oxygen also in business class.
Okay.
So I also wanted to highlight there was a labor class worker, the blue collar worker in one hospital in UAE,
Okay.
and he wanted to go to Nigeria. The patient was not affording, and his sponsor was also not able to afford that much of money. So we shifted that patient in economy class with one syringe pump with oxygen on board. So that has reduced the cost for air from, if you compare from air ambulance as a private charter flight to a economy business class, 95%.
Oh my god,
So
that's
we
huge.
did the evacuation only in 5%. So there are lots of people ask on Google also how this medical escort work. So medical escort can be provided to the patients who can comfortably sit as a wheelchair packs. So next to the business class of the patient seats, our medical escort will sit, and we will have all required medical equipment on board, and whenever require he can administer the medication to the patient, and if the oxygen is needed he can start the oxygen because the oxygen cylinder will be next to the medical escort. So this way commercial airlines business class air medical evacuation works. So that is really helpful for the patient, particularly for an international patient. And domestic also we can use because there are lots of airlines, particularly Vistara, and Air India is providing business class. Other than business class, we are using the first row of the aircraft, though you get more leg room. So in such, if the patient is not able to afford business class, we can even do it in economic class in first row of Indigo and all other airlines. So this is about your frequently asked questions. Hope I have answered well of all your queries.
Sure, I hope our audience will get a clarity on air ambulance services and what are the criticality in that. Thank you.
Thank you. Thank you, Karina.
Thank you, sir. Welcome.